Hello, my name is Suzanne Mukherjee and I'm a researcher at the Martin House Research Centre here in York, where I'm working with Bryony Beresford and Lorna Fraser to develop a patient-reported experience measure for children and young people with life-limiting conditions. The purpose of today's brief presentation is to introduce you to patient-reported experience measures, otherwise known as PREMs. I'm going to be focusing on what they are, why they're important, and then I'll briefly tell you about our current research project to develop one. It's probably worth pointing out at this stage that the research I'm talking about today is being carried out in partnership with Professor Richard Harding and his team in King's College London. They're developing a patient-reported outcome measure. So I know that Richard will be talking about his work on developing an outcome measure in his conference plenary. So if you have a particular interest in PREMs and PROMs, it's probably worth catching his presentation alongside this one, as the two should fit nicely together. So I'm just going to start by talking a little about what patient experience is. So in its broadest sense, patient experience is what the process of receiving care feels like for the patient, their family and carers. However, as with most things, it's a little bit more complicated than that. Research that's been carried out with adult patients who have had a range of health conditions and across a range of settings indicates that there are actually different components or domains to the healthcare experience which are important to patients themselves. So both the Institute of Medicine and the Picker Institute in Europe have proposed that patient experience is composed of 6 core domains. And this framework of patient experience is one that has been used by researchers, practitioners and policymakers across the world to guide their own work. So these 6 domains are respect for patient values, preferences and expressed needs, coordination and integration of care, information, communication and education, physical comfort, emotional support and involvement of family and friends. And in addition to that, Picker have more recently added 2 more domains based on their own additional research, and that's transition and continuity and access to care. What's important to realise in looking at these broad domains, that layered on top of this, it's possible to look at different aspects of the care experience within each domain. And there are 2 broad aspects. One is the functional aspect of care. This is about the content of the process and what patients did or did not get. And then there's the relational dimension of care, and that's about the nature of interactions between the patient and staff. Importantly, work carried out by the Department of Health in 2011 indicates to us that it's actually the relational aspect of care that really matters more to patients. So I want to move on now to talk about why this matters. Why does patient experience matter? So within the UK, but also internationally, there's broad agreement that patient experience alongside clinical effectiveness and safety are what determine quality of care. So patient experience is a core component of care quality. But in addition to that, there's also growing evidence that these components are actually linked. So a number of systematic reviews of the literature have found that positive patient experience is associated with self-related and objectively measured health outcomes, such as pain and anxiety, adherence to recommended clinical practice, preventive care, reduced resource use, and increased satisfaction. So multiple reasons why we might want to ensure that patient experience is a good one. So measuring patient and family experience, how do we go about doing that? Well, there's lots of possible ways to gather information about patient experience. You could run focus groups, you could carry out in-depth interviews, patient forums, multiple options. But patient-reported experience measures, or PREMs, which is what I'm here to talk about today, are questionnaires which quantitatively measure patients' experience in a systematic way. And that means that quantitative systematic aspect to them means that they can be used to identify aspects of service provision that might need improvement, be used to compare different service models, and evaluate the impact of interventions and initiatives. To be used in this way, they must be robust psychometric scales. So if you are interested in looking for a PREM for your own use in research or in practice, this comes with a word of warning. When you look at questionnaires which label themselves as PREMs, many are not actually, and that's a particular issue around questionnaires that label themselves as PREMs but are in fact just satisfaction surveys, which are quite different. The great majority of PREMs only measure transactions, and as I've said to you already, it's the relational aspects of care that often matter most to patients. And many do not capture all of the different domains of care as laid out in the PICR and IOM framework. So what about PREMs for children? What's available? It's been known for quite some time that this is a neglected area. And as part of our work, we've been carrying out a scoping review in which we've looked at what is available. And we found that PREMs for children are, first and foremost, very small in number. There's really not much out there. Almost all only look at the transactional aspect of care. Many are condition specific and measure only the parent's experience, not the child's experience of care. Some are restricted to particular settings, and some are also not particularly robust psychometric measures. What that means is that at the moment there really is an absence of PREMs which can be used with all children with life-limiting conditions and across a wide range of settings. That brings me to our current project, the PREM development project. Our aim at the Martin House Research Centre is now to develop a brief measure of patient experience, which can be used in any setting where children have a life-limiting condition and are receiving care and treatment. Our aim is to produce a version that can be completed by children and young people themselves, and also to produce a parent proxy version when children are unable to complete the questionnaire. The process of developing a PREM is long. It involves a number of different stages. At the moment, we're in the early phases of this work, so we're coming towards the end of our conceptual review, and we're about to begin developing items for the measure. As I've said before, the work is in partnership with the King's College team in London, who are developing a PROM, and the aim in doing that is to develop parallel measures that are complementary to each other and can be used as a complete package for those who are interested in looking into the outcomes and experiences of patients using their services, either for research purposes or in practice. So if you're interested in keeping up with progress in this project, please look at the Martin House Research Centre website, where we'll be posting updates on progress. So many thanks for your time and attention today. I'll just draw your attention to the fact that the references that have been used in this presentation are at the end of the slides. And I look forward to hopefully meeting some of you at the Q&A session on the day of the conference. Many thanks.